Hi, this is Phil Newman from Longevity.Technology, and today we're going to be talking longevity supplements. And I'm joined by Shantanu Kumar, Eugene He, and Toby Chin, who are from Xandro, a Singapore-based longevity supplements company, and also Dr. Shan Hisham, who's a practicing longevity physician. So, gentlemen, good afternoon.
Good afternoon.
So obviously, we're very aware now that there are longevity supplements coming into the marketplace. Quite a lot of companies entering the space. So what makes the Xandro approach different?
So I think we see Xandro as a brand that is really focused about on optimizing human potential and performance, right? So we are in the best position to really strive for longevity and health span, whatever your expectations are. I think it's very easy to try and say that Xandro is a biohacker brand, but we're not. While we might seem like a candy store for biohackers, but I think really what we're trying to do is to have a scientifically curated range of supplements and ingredients that even general consumers can come in and say, hey, this is something that I need, or this is something that my doctor recommends.
Yeah, and Eugene, on that point, I guess the biohacker tag is something that is a positive and a negative for some people. So I guess you're trying to bring what would be considered perhaps biohacker technology to mainstream. Is that right?
Well, see, I've been biohacking for the longest time. So, for someone like me who's been doing it, I think my expectations are very different. The kind of supplements or even ingredients that I go for are very different. Sometimes very extreme. They're not for everyone. So I think, with Xandro, we're not experimental like that. But we just want to take best practices, best science, best research, and just put whatever that's at least generally, verified, available to consumers.
Understood. And Shantanu, what are your thoughts on that?
When we started Xandro, there was a very specific point. We wanted it to be a lot more accessible to people. It shouldn't be what we saw out in the market. Things were priced beyond the measures. We talked to consumers and they said, I tried it for a week, for a month, maybe 2 months, and then I had to quit because it was just not sustainable. So what we have tried to do is make it a lot more accessible in terms of price point, in terms of how long you can use. You'll see that in our price point as well as our dosage, we generally do about 2 months dosage in the same price point. So that's one part, making it a lot more accessible. The second part is, while people have heard about longevity supplements and biohacking in general, the knowledge or awareness is lacking beyond the top, let's say, 1% people. So we spend a lot of time in educating. We, I think right now we have, our blog is more than, I think, close to 500 different blogs. All of these are curated, and we have done a lot of research before writing these blogs. We're doing that education on social media. Beyond that, but longevity supplements, or let's say biohacking, and then also ensuring that this becomes a practice, it's a lot more communal effort, which is where a community comes into place. So that's where we're spending a lot of time in collaborations and building smaller communities where people work together. So it becomes a practice rather than just a commercial business outcome. So end of the day, the consumers also have to benefit. That's our thesis of building the brand.
Okay, and tell me how. So when you decide to bring products to market, how do you decide on those products, and when do you decide to launch them?
So I'll start with this first. A lot of the products that we have launched, a lot came from, again, my personal experience with these products. But, of course, all of them, they're based on, looking through the literature on longevity science, health span. I spend a lot of time reviewing clinical papers, and also I work very closely with suppliers around the world, trying to evaluate, the studies that they've done. And it's not just that, I think when you look at a single ingredient, there's so many suppliers, which one should you go for? How are they standardized? These are the things that we look at as well. What kind of what's the manufacturing process of the ingredients? How do they verify, the active ingredient content, of these ingredients? These are things that we look at as well. I think this is something that you can't really just pick up like this. I think we do have the experience in this industry for myself almost 15 years. So I think with Xandro, what we're trying to achieve is that if you're looking for a specific ingredient, for example, calcium AKG, then you know that with us, with the calcium AKG that we have, we have already done the required like steps that we take to make sure that by the time you buy this product, everything that is in the product is verified.
Understood. Yeah, and Shantanu, what did you see as the trends and demands from your consumers?
So there are what we generally do is the consumer trends becomes very important. End of the day, anything that you do has to have commercial value. Talking to consumers, so a lot of our consumers come up to and say, "Okay, do you have this particular ingredient? Do you have spermidine? Do you have AKG, or do you have something else?" We get a lot of requests on taurine at the moment. So that's one part of our getting the consumer insights in to understand what people are really looking for. Beyond that, we keep looking at what's happening around the world. So it could be, let's say, Brian Johnson or David Sinclair or other people who are doing let's new research and that generating demand. We also do a lot of research on different marketplaces as to what are consumers picking up. That becomes a source of consumer trends, which then also adds into the whole research part of validating okay what will potentially work for us.
Yeah, and of course, let's talk about some of those trends. So, Dr. Hisham, of course, you're at the front line of a lot of this. So, what are you seeing are the emerging trends in longevity and wider health that you see?
So the obvious thing is that there's a lot of interest amongst patients, amongst clients, amongst people in general in longevity science. There's a lot of information out there to decipher. So one of the things that I am particularly interested in is in the field of testing, right? There's a lot of diagnostics there. There's a lot of science in terms of molecules, biomarkers, and genetics, and everything else. But how do you translate that into clinical practice? How do you translate that into to the masses? Because at the moment, longevity and biohacking usually is not everybody has $2 million to spend on themselves every year, right? So how do you make it mass market? How do you make it accessible? And I think part of it is using technology, AI, to decipher all the information and putting it all together and things like that. So even in my practice, it takes me hours to even put together all that information from just one patient, right? So I think the exciting part is actually marrying the AI, marrying the technology, diagnostics, and of course, how do you translate that to management? And which is why I'm interested, in working with Xandro on supplementations, which my patients ask for.
Yeah, very interesting. And Toby, obviously, we haven't spoken with you yet. What are your thoughts on trends and topics in health around longevity?
Well, I think I'm not sure if I would call it recent, but there's actually quite a bit of interest in NAD metabolism. I myself worked on it quite a bit, and it's been shown multiple papers, multiple labs in multiple journals have shown that by supplementing the body with NAD, you actually can reverse or maybe attenuate some negative effects of aging. And also, I think one thing that's very exciting in the field now, in longevity and anti-aging, is actually senolytics, which is the targeted killing of senescent cells. And it's actually been, I think it's quite well accepted that the primary cause of all the age-related issues is actually due to senescent cells. So by killing these cells, we actually can allow people to live longer and healthier.
Understood. And I mean, I guess collectively, what do you guys think is the future for nutritional supplementation? Shantanu, what are your thoughts?
Uh, for me, it's like it will become daily life. It's normalization. People would I see people taking anti-aging, or let's say a supplement for their breakfast, for their lunch, for their dinner. It becomes almost like a routine, very similar to a workout routine where it's everything is measured and then People follow that particular routine. Beyond that, there's also I believe a lot more testing will happen, a lot more measurement will happen. Possible devices coming into place which measures your body to a very specific measurements. Today the way we have our blood, the blood pressure or blood sugar measurement, will have very very similar things coming in. That's how I see the future going in.
And Eugene, what are your thoughts on some of the ingredients that are out there?
Well, I think definitely a lot more new novel biotech ingredients, right? Things like your lab synthesized bioidentical peptides. Maybe we'll see like senolytic ingredients or ingestible exosomes. I think what we're going even more granular now, with supplementation, right? Because ginseng, for example, it started off with ginseng root in a capsule. That's version 1, and then version 2, you have ginseng root that is standardized for ginsenosides. And now we are at level 3, version 3, where we could have ginseng root in a capsule that's standardized for number of exosomes. So I think we are going even smaller and smaller with what we can derive from these ingredients. But I also see potential and more common conflicts with the pharma industry for sure, as nutritional supplements becomes more effective, more accessible and more widespread, and also conflicts with regulators. I think this is something that we have faced recently with NMN. We're going to see more of this, with more ingredients. So I think we definitely it's a struggle and a challenge that we'll probably foresee in the near future.
Yeah, and of course, Dr. Hisham, you're at the front line of all of this in relation to this crossover between supplementation and therapeutic benefits. And I guess a lot of this is based on evidence. So maybe you could talk to that a bit.
Well, if we go back a few decades ago, when I was still in medical school, we were never taught about this. We were never taught about nutritional supplements. It's only recently that it's cropped up. And if you ask the majority of doctors, right, medical practitioners, they won't know about this, right? They won't know about spermidine, AKG, resveratrol, and everything else. I think we need to start, as medical practitioners, need to start learning about it, educating ourselves about it, because our patients are using it, right? And it will become mainstream. A lot of people say, "Oh, I'll just have a balanced nutrition, balanced diet." Okay, but I can tell you that the majority of us in our modern lives are far too busy. The food that we eat is all processed, most of it, and we do need this supplementation. It will become mainstream, right? I've got patients taking 30, 40 supplements per day, right? And my job is to make sense out of that. So our doctors need to educate themselves. Needs to be a lot more evidence-based guidance for the usage of supplementations, I think. So I think those are the things that needs to be done, but it's going to become mainstream.
So let's talk about research and clinical findings. What have you guys been working on? Toby?
So I think a large part of what we've been working on is on actually aging. So primarily in the skin. So we are looking at how we can use certain natural compounds that could act as supplements to see if they actually have any senolytic capabilities. So I think that's something that I think has a huge potential and something that we're focusing on a lot right now.
Understood. And Eugene, about your research work as well. What are you up to?
So I've been doing a lot of on-the-ground research. I'm actually doing a project right now where I literally travel around the world, go into communities, and interviewing centenarians and also understanding people in these cultures in this part of the world, how they're eating, how they're living, and trying to find if we can find solutions or answers to why some of these people can defy all odds to live really long lives. And then I'm documenting the entire process, into a docu-series, but also taking away a lot of the knowledge and seeing how we can translate that into the lab, into viable studies.
That's very interesting. Well, obviously, traveling around the world, you're getting exposure to a lot of very interesting science out there. And Dr. Hisham, I guess you're on the front line. What about the clinical side of things? What are you finding in terms of your new research activities?
I practice longevity medicine, but I have a specific mission. I'm trying to democratize it, trying to take it to the masses. So at the moment, what we're trying to do is work out a program, I would say, where people can access longevity in bite-sized pieces, and then and then what we want to see is collect data from that, and then see whether it makes a difference or not. Because not everybody can spend tens of thousands of dollars on their longevity kind of assessments and management. So what we're trying to do in my clinic, in my clinical practice, is to then make it into bite-sized pieces, get my patients to go through it, collect the data, and see whether it makes any sense and whether it works or not, right? And hopefully it works, right? So we are seeing some positive results, and it seems to be working. The only thing is that longevity is very personalized. So you have to balance personalized to democratize, right? So it's tough, but we haven't found the formula yet, but we're working on it.
Yeah, and of course, Shantanu, you're working with Dr. Hisham as well as other doctors, right? In terms of getting these collaborations going. Maybe you could talk a bit more about that for us.
Sure. So the one of the big gaps in the space is the people who are interested. So we get calls from consumers that, okay, I have this problem, I have that problem. How that's one set of the consumers who are aware of the problems. Then the second set is, okay, I've heard about this ingredient, I've heard about it in social media, but how does it really work? Which is where now there's an interest out in the market with consumers. Uh, this needs to be connected to the experts. Now, experts come in form of people who've been doing this for long. This could be doctors, this could be biohackers, this could also be researchers and scientists. So that is a building block that I'm currently working on. A lot of this in very simple terms will result in education through social media and also other platforms. Let's say, for example, a monthly meetup group. So that's another initiative which is we are starting off in Singapore in April, where on a monthly basis we sit down with 30 to 40 people who are interested to know about supplements, and then share a lot more and understand from different practices. So it boils down to a very sharing of best practices and knowing what's really working. Beyond that, I would there's one more agenda which I'm working on, which is how do you really measure the difference? Something that Dr. Hisham spoke about, which is now you're taking a lot of supplements, does it really help? So that would need everyone to start measuring, or let's say measure at a specific interval. So that's another part that we are currently working on.
And Eugene, you've got a lot of work going on at the regulatory level, I guess, looking at what's going on in different countries and understanding the complexities of bringing some of these products to market, right?
Yeah, and it's really challenging because it's not as simple as trying to bring ginseng to another country now, right? We're trying to sometimes we don't even know what to call this ingredient. So do you define it as food, or do you define it as pharmaceutical or supplement? I think that is a hurdle that we're faced with every day, and also trying to explain to the regulators as well what these ingredients are. One thing that I do wish that we see for the future of nutritional supplements is that there could be this global harmonizing of regulatory laws, because it's just so complex. Every country has their own set of rules, and rules are developed and determined by people, and most of the times these people are not really on the ground nor in this industry, so it's just really challenging. But I think that's definitely a way. I think with AI and also with the community coming on board, we're definitely putting pressure on regulators for them to understand more of what the people need. I also want to add on the point where while this may or may not be a challenge, is that because longevity and science is overlapping with other categories today, like beauty and wellness, we're also starting to see big brands, brands that we know use these terms. So then suddenly they become also longevity experts, which kind of makes things even more challenging and difficult sometimes, because then who are the experts today? So I think where we are right now today is a time where we are trying to harmonize both within the industry and also externally as well. And hopefully within the next 3 to 5 years, we can find common ground.
Yeah, absolutely. There are some complexities coming at us because it is a international industry, and accelerating some of the benefits of these new compounds and molecules is very, very exciting for the rest of us. But I guess, Dr. H, in relation to the public policy side of things and the work that you're doing there, this is quite an important part of bridging this industry into mainstream healthcare, right?
Yeah, so at the moment, longevity in Singapore, longevity is thankfully accepted or recognized by the government. We have a Center for Healthy Longevity at the National University of Singapore. We have a longevity public clinic in Alexandra Hospital. And we have a few private clinics up and running as well, which are licensed medical clinics. I think but at the moment, the current healthcare system is geared towards treating. It's not really healthcare; it's sick care, and I think changing that paradigm is very, very important. Now, together with that, is also payer. You can easily get treatment for if you have a heart attack, but if you want to prevent a heart attack, you can't, right? You have to pay out of pocket, which is strange. So I think those things, and there's a lot of misinformation out there, but there's also a lot of misinformation out there. So to decipher that, to distill that, I think is really a major challenge, because you get patients who come in and they're doing things which are perhaps not suitable for them, but they believe it because they got it from TikTok, right? So yeah, so those I think are the three or four top challenges that I face day to day.
Yeah, and of course, I guess, as you say, we can learn things on TikTok, or we can learn them from peer-reviewed papers. But I guess this is all about evidence, right? So, Toby, what are your thoughts on that?
So I think because it's nutrition, the major concern that I have is safety and efficacy. So, being nutrition, we don't have as much people looking into it as compared to, say, pharmaceuticals and small molecule targets. So the data often isn't as robust as say a small molecule inhibitor or a new pharmaceutical. So we need to really look at the data that's published, even though it's peer reviewed. We need to look at it to make sure that the data is good, the data is accurate, the experiment is well designed, and also because it's not a pharmaceutical, so the regulatory requirements are much lower as compared to, again, say a new drug. So this brings to mind concerns of safety. So I think this is, for me, coming from the science part of things, I think this is what I would be more concerned with.
Yeah, well, of course, we've touched on some very important subjects in our conversation today. This translation from supplements into therapeutics, as well as regulatory pathways, and really the internationalization of this industry, as we are all part of it today. So thanks to the Xandro team and Dr. Hisham for joining us today. It's been fascinating. Thank you.
Thank you so much.
Thanks, Will.
Thanks for having us.